concept that is extremely important to understand is the concept of moral hazard. Um, and so, what moral hazard, um, well, so just to back up, so remember that insurance is based on the premise that payments are made only for random losses that you know, and that these random losses, um, again, it's all random, and but the problem is that moral hazard says that sometimes we consume more healthcare because individuals don't bear the full cost of the services provided. So let's actually take an example. Um, so I always like to tell this story. Um, so my father had this like face cream that he put on like you know once once a month he had to add it, or maybe twice a month, every other week once he had to add it to his face, and he had this little tube, and he would add it because sometimes his face would get like itchy, and he under his normal health insurance policy, my mom would just went and filled a little tube, and his doctor had written a bunch of um, a bunch of refills for this tube of medicine, this cream ointment. Well, my dad works and he drives 40 minutes to work, and he comes home after a couple months and he's like, gee, it would be really nice to have, that little tube, a tube just like I have at home, but have one for the office because, like if I get itchy, if my face starts to itch, I'd love to be able to put it on, right there instead of having to wait till I get home. Um, so my mom goes out and fills a prescription and she brings it home to him. And, next thing you know, kind of fast forward a few months, my dad has one of these tubes in the car. He has one for his travel dop kit because my parents like to travel on weekends a lot. He has like 4 tubes of this medicine hanging around different places. Um, and each of them are pretty full. Like he maybe uses it once a month, maybe takes from a single tube once a month. Um, well, then my parents got into a different healthcare plan, and he had a much higher deductible. And my dad, says to my mom, "Hey, can you go and fill this prescription? I just need a tube." And my mom calls him, and she's like, "Bill, do you really need this tube of medicine?" And my dad's like, "Well, yeah. What's the problem? Like, I want one for, I want one for the other car that we drive. I want one in another place." And my mom says, "Well, I'm asking you because it's $550, and my parents hadn't met their deductible yet, so my dad was gonna have to pay it." And my mom says, "Do you absolutely still want this medicine? It's $550. I'll get it if you need it, but it's really expensive." And my dad says, "Absolutely not. Do not buy it." And the point of that story, even though it was a little long, is that what moral hazard says is that my dad was not prior to joining that new health insurance plan. He was filling a prescription, because he really wasn't exposed to. He didn't know the true cost of it. For him, he was just paying a small, $15 copayment each time he picked it up um, each time he picked it up. But the reality is it was a really expensive medicine. I mean, that not everybody can. I mean, that's a really expensive medicine. But the moment, and essentially, it means that he consumed more healthcare, bought more because he didn't know the true cost of it. And I think this happens a lot. And so, how do we deal with this in insurance? And you know, you want people to kind of be active members, and you want them to be exposed to healthcare costs, in some ways, so that they're good consumers of it. But they also, you don't want them so exposed to costs that they feel like they can't, that they can't use it when they absolutely need it. So there's kind of a balance, but there are really, the following ways. First off, I just want to make sure I have included the definition for premiums because I want to make sure everyone understands what a premium is. But premium is the dollar amount that insurers pay to be covered under insurance policy, and it's usually paid on a monthly basis. Um, so that's just what you pay just to be in the insurance plan. And then you have deductibles. And so this is a dollar amount that must be spent on healthcare services in a year before any benefits are paid by the insurer. So, for example, you know, your deductible could be $1,000 a year. And, essentially what that means is that, every time you go to the doctor, you'll pay, the full price until you hit that $1,000. And then the benefits start being paid by the insurer. And, you kind of hear these stories nowadays that these deductibles are, at crazy amounts. And it's kind of interesting. And so what this does is this means that, you're going to really think about, if you need to go to the doctor, if you have not met your deductible yet, because you're going to have to pay that out of pocket. So the next thing that they do is they have a copayment, and this is a fixed cost, excuse me, to the patient each time a service is rendered. And what this a lot of people pay like $15 or $30 every time they go to the primary care physician. And the idea is that by having some sort of coinsurance or fixed amount that you pay every time you go, you will be sure that when you go to the doctor, you're not just throwing away $20 or $15, however much your copayment is. The next thing that insurers do to deal with this issue of moral hazard is they have coinsurance. And coinsurance refers to the sharing of costs between the patient and the insurer. So, for example, oftentimes what they'll say is after you have hit your deductible, the patient is still responsible for 20% of all costs related to a hospital care. And again, this is a way of keeping the patient exposed, but not, but still offering them some sort of coverage. And the next thing that we're really seeing is what's called the high deductible health plan. And high deductible health plans is a type of health insurance that requires a high deductible. So, sometimes you'll see it as like a $5,000 deductible. But it allows individuals to set up what we call tax advantage savings accounts, which are called HSAs, health service accounts. And what this does is it says, it allows people to take out, dollars pre-tax, so they're not taxed on it, and they can put it into a healthcare, like a health savings account that is a bank account that can only be used for healthcare costs that are and things like visits to the doctor, tests, labs, if you need prescriptions and so forth. And then what ends up happening is that this account, if you don't use it at the end of the year, rolls over to the next year. So you can continue to build up this pre-tax savings account, which you're not taxed on at any point, and it continues to roll over until you have a healthcare event. So again, the concept is that, you have a pre-tax advantage, so, and you have a savings account that you can pay for with this stuff, but, you're exposing people more to the healthcare costs so that you can kind of make sure that when they do consume healthcare, they actually need it, and you can kind of control for this moral hazard problem. So the next part of the lecture is I'm going to give an overview of of where we are as a country and the extent of the nature of coverage for employee-sponsored insurance, the individually purchased insurance, Medicare, Medicaid, and then kind of where we are with the uninsured. And I apologize. A lot of this, most of this data is back to 2011. It's really hard to get access to some of this data, and I just haven't gotten to get kind of like the next round of numbers.